failures to protect Britain from the COVID-19 pandemic have been laid bare in a landmark report stating that never again can a disease be allowed to lead to so many deaths and suffering. The UK COVID-19 inquiry's first report outlined 10 recommendations as bereaved families gathered outside the hearing in Paddington, West London. It outlined a damning verdict on how well the UK was able to face a deadly outbreak in the run-up to 2020 when the coronavirus swept across Britain. Key recommendations include staging a UK-wide pandemic response exercise every 3 years, including how to protect vulnerable groups who were left exposed to COVID-19. Inquiry Chair Baroness Hallett is also demanding the creation of an independent statutory body responsible for preparing the nation for the next deadly virus. Opening the report, Baroness Hallett said, "The primary duty of the state is to protect its citizens from harm. It is therefore the state's duty to ensure that the UK is as properly prepared to meet the threats from a lethal disease as it is from a hostile force. Both are threats to national security." Lady Hallett told of the harrowing testimony of loss and grief given by bereaved witnesses, adding, "There must be radical reform. Never again can a disease be allowed to lead to so many deaths and so much suffering." COVID-19 was linked to 235,000 deaths and came after a decade of Tory austerity policies which had shrunk the public sector. Prime Minister Keir Starmer said, "The memories brought about by the inquiry will be very difficult for many people. My heartfelt sympathies go out to all those who lost a loved one during that time." Today's report confirms what many have always believed, that the UK was underprepared for COVID-19, and that process, planning and policy across all 4 nations failed UK citizens. He added that his government was committed to learning the lessons set out. The report outlined a lack of surge capacity in public health staff and contact tracing infrastructure to control a new virus. The report outlined that the UK had been warned by the 2002-03 SARS epidemic that struck Asia that greater surge capacity was needed in the public health system. The Health Protection Agency published a report in 2005 stating there was limited capacity within the public health system to surge staff resources in the event of a prolonged outbreak. The Module 1 report stated, "The entirety of the UK's testing and contact tracing system was therefore designed to deal only with a small number of cases of emerging infectious diseases." The probe had heard evidence from Dame Jenny Harries, head of the UK Health Security Agency, who said that 40% cuts in real terms to Public Health England's budget affected the ability to move quickly. Widespread contact tracing was abandoned early on in the pandemic due to a lack of tests and contact tracers. Later attempts to set up NHS test and trace using outsourcing firms failed to have a significant impact on the outbreak trajectory. The report, which only covered pre-pandemic preparations, concluded, "The international experience of the 2002-2003 SARS epidemic, and the domestic exercises that followed, revealed a number of important lessons." If these lessons had been heeded, and put into domestic context, the UK would have been better prepared for the COVID-19 pandemic when it struck in January 2020. The report found that limited resources was a widely recurring theme in evidence and that the UK had been made more vulnerable by Brexit. It said government planning for a no-deal Brexit caused resources to be allocated away from pandemic preparedness.